5 early symptoms of stomach cancer that are often mild and indistinct. There are more than 200 types of cancer that can grow in the human body. Symptoms of each disease will depend where the cancer is, as well as how severe it is. In some cases the signs might not immediately prompt concern, meaning the cancer could go by undetected for a long time. One expert warned this can be the case with stomach cancer, as early symptoms can be mild and indistinct. Speaking exclusively with Express.co.uk, Dr. Deborah Lee from the Dr. Fox online pharmacy said, 4,200 people die in the UK every year from stomach cancer. It is Britain's 14th most common cancer. Unfortunately, it is often diagnosed late when the cancer is already advanced and curative treatment is not possible. The early symptoms of stomach cancer are often mild and indistinct, so it is passed off as other conditions. According to Dr. Lee, these symptoms can include feeling full or bloated after meals, indigestion, acid reflux, trapped wind, tummy pain, difficulty swallowing. This is an unusual symptom, which always needs investigation. However, as the cancer advances it can also cause loss of appetite, nausea and vomiting. Sometimes vomiting is described as coffee grounds, which are lumps of old dried blood. Weight loss, black stools. This is old, altered blood, from bleeding into the gut. As time passes and the tumor grows, loss of appetite, nausea and vomiting and weight loss may set in. It tends to metastasize, spread, to the liver and the lungs, Dr. Fox said. Liver metastasis cause jaundice, upper right-sided tummy pain, nausea and vomiting. Lung metastasis cause shortness of breath, chest pain and pneumonia. The symptoms of stomach cancer can be mistaken for gastric reflux, peptic ulcers, gallstones or pancreatic cancer. When should you see a GP? Dr. Lee urged people to speak to a doctor if they are concerned about any of the symptoms listed above. She said, see your GP if you have new and persisting indigestion or other gastrointestinal symptoms, especially if you also have other symptoms such as loss of appetite and weight loss, or difficulty swallowing. Most people will not have stomach cancer, but it's important to be tested and rule out the diagnosis as soon as possible. If caught early, the prognosis for stomach cancer is much better than if it is diagnosed late. Your GP will assess you and refer you if needed to see a gastroenterology consultant. The NHS advises seeing your GP if you have problem swallowing, a lump in your tummy, lost a noticeable amount of weight. Other symptoms of stomach cancer that get worse or do not get better after 3 weeks. A condition that causes symptoms with your digestion that are not getting better after 3 weeks of using your usual treatments. How to lower your risk of stomach cancer. Dr. Lee said the following factors can raise your risk of developing stomach cancer: being male, being over 55, smoking, this doubles the risk, alcohol, drinking 3 or more units of alcohol per day increases the risk, eating a low-fiber diet, or a diet high in pickled foods, red meat or salt. H. pylori infection. This is a type of bacteria that lives in the stomach and is known to be carcinogenic. She advised, you can reduce your risk of stomach cancer by eating healthily, reducing your intake of red meat, eating more fiber in your diet, stopping smoking and reducing your alcohol intake to the recommended limits of 14 units per week, spread over 3 days, with several alcohol-free days per week.